Hello, Ellie.
Hello.
Hi. Thanks for talking to me. So, you were fifth year last year, is that right?
Yeah.
At the Central Manchester Foundation Trust.
Yeah.
And did you get involved with lots of the revision resources going on there?
Yeah, I got involved in most of them.
Okay. So, what did you do?
I went to the F1 lectures that were provided by the F1s. I went to the F1 weekend, the week before finals. I went to mock OSCEs, and I think that's it.
Did you attend any of the ward-based teaching and tutorials?
Oh yeah, I managed to get into one ward-based teaching, which was good.
Okay. And what did you think was the most helpful out of all the different things that were going on?
I thought the mock OSCE was the most helpful, especially because it was just long enough before finals that you could do the OSCE, realise what you didn't know and what you needed to know, and how you could improve, and you had enough time to go and then practice stuff and get better before the actual finals. And it was set out like an actual finals exam. It's quite serious, but then not. So you kind of get really good feedback in an exam situation. So that was good.
Okay. And what other resources were particularly good?
I like the ward-based teaching by the other F1s because we went to see patients on the wards with specific pathology that had come up before in finals, like fistulas and renal transplant. Then we just examined them and we got kind of told what to examine, what we should be looking for, how to do it, and once we'd examined we got feedback on how to improve. So that was really, really good because that was actually like doing an OSCE on the ward with a real patient with pathology. So
Okay.
I did that.
So there's quite a lot of practical teaching. What did you think of the electronic resources and books?
I thought the electronic resources that we provided were really, really good, especially because we've got iPads provided by the university. So the e-books with all the exams, they were excellent because it just gave you a step-by-step, short, concise guide on what you should do in the station, how to approach it, how to be systematic, and how to answer any questions afterwards. So I found them really useful, especially if you put them together with the mock OSCE after, and you could go back and look at how you should have done it and how you should have approached it, and then next time you knew what to do. So that was good.
Okay. And did you, outside the university, a lot of people use the paid courses. Did you attend any of those?
Yeah, I went to Ask Dr. Clark, but I didn't actually think it was that good. I thought the textbook that they provided was really good because it was kind of a revision guide, but I thought the course was too early. It was like September, October time, and it was very superficial, so it taught you quite a few things, but really superficially, you didn't understand what was going on. So unless you remembered them as like an actual 5 courses of AF, you didn't actually think about it too much, so I didn't think it was that useful really. I thought you could absolutely get by and get the same result without going and just using the resources provided by the base hospital.
Okay. And what did you think about young F1s teaching that had done the exam the year before versus consultant teaching?
Sometimes I thought the F1 teaching was better because they've been there, they know what came up more recently, and they know how they approached it, how their friends approached it, and they got graded on it and feedback, so they could tell you what they got, what they did wrong, what they'd do better next time. But then sometimes I felt it was lacking, as they wouldn't be able to tell you some of the questions that you had, they wouldn't be able to answer them. So the consultants are obviously a bit more wise than the examiners themselves. So I think a good mix is better than just one or the other.
So having both is the best thing,
Yeah.
and then it depends on the teacher to some extent.
It does depend on the teacher. Some teachers are really good and some F1s are excellent at teaching, and you feel that they are as good as some consultants. But then if they're not very good teachers or they need to improve their teaching skills, then it's sometimes not very helpful and more confusing.
Okay.